Hello, this is Dr. Tall Paul Simon, psychiatrist. Wanted to talk to you today a little bit about the difference between psychologists and psychiatrists. First of all, I'm a psychiatrist, so I went to medical school and I am licensed as a physician and I specialize in the treatment of psychiatry. Okay. So I have been in private practice for about 15 years and I see patients on an outpatient basis. Um, I've worked in hospitals and psych hospitals, emergency rooms, general medical floors, and different settings like that. So, what is a psychiatrist? Okay, it is basically what I just explained. It's a physician. Um, I practice medicine, okay, and my main tool that I use is medications. Now, other tools that we use would be therapy or counseling, similar to what a psychologist or a counselor or a therapist would do. But most psychiatrists nowadays primarily use medications mostly because you don't have to go to medical school to be a good therapist. There are a lot of medications out there that can really help with a wide variety of mental health problems. We have to diagnose uh, patients before we decide what medications may or may not be indicated for that situation. So, as a psychiatrist, I've also been trained to diagnose mental health conditions. Now, as a physician, um, I'm trained to recognize medical issues as well. So, like health issues that may lead to depression or other mental health problems like psychosis or delirium or dementia, different things like that. It's my job to rule out these other things if they haven't been already ruled out as far as being a cause for mental health issues such as depression or attention problems or anxiety, things like that. So it's definitely approaching mental illness from a medical perspective. Now, being a psychiatrist, you really need to be holistic in your care. So it can't just be medical things, but also you want to look at um, the situational factors that contribute to these different mental health issues. Like, has there been trauma or abuse, or is there ongoing, cultural things such as poverty or educational issues that may be contributing to the person's problems, employment problems or home life things, or all these different things that can factor into our health and well-being, really trying to assess holistically all these different factors and trying to account for all of them is a daunting task, but that's what a psychiatrist such as myself is tasked with doing. Um, Now, a psychologist is somebody who has gone to a university and gotten an advanced degree, either a master's degree or a doctorate level degree, in the study of psychology, which is the study of the psyche or the mind. And that may include some degree of biology to it, but not to the depth by any stretch of the imagination that a physician would have. For example, a physician has literally dissected brains, and studied how to read MRIs of the brain and do neurological exams and treat strokes and seizures and dealt with these things in emergency room settings and hospital settings and outpatient settings. So, a psychologist with a PhD or PsyD, which is a psychological doctorate, just does not have that medical background. They are, I would say, better than a physician in a lot of ways if you're dealing with therapy and counseling and mental health issues that don't require medical evaluation and treatment. So if, let's say, somebody comes to me and says, "Oh, Dr. Simon, I'm depressed. I don't know what to do about it." If they need therapy, which usually they do to some degree, I will not be doing the therapy myself. I will be referring them to a psychologist or a licensed social worker, clinical social worker who would do therapy and counseling. to try to help them in their life from a non-medical perspective, because I will be seeing the person during brief visits once a month, or less. And that just doesn't include, hour-long sessions every week or two where, we can get into these deep-seated, maybe trauma history issues or current life situations and the changes that need to be made in the person's life, and nurturing that motivation that's required to make these changes. While I care about those things, my professional expertise is such that it is better applied to the medical side of it and the medication side of it. Now, I often will try to give bits of advice and offer insights or perspectives that may be useful to the person, especially as I've said, sleep hygiene and different things like that, but I'm not spending an hour every week or two really getting in depth with things. I don't do couples counseling or family therapy. I may, again, give advice or make recommendations and things like that, but not near the extent as a psychologist would. So yeah, I hope this information helps you understand what the difference is between a psychologist and a psychiatrist. So if you have a psychiatrist and they don't do a lot of the therapy and stuff, I would consider getting a psychologist too. It's kind of like having a knee problem, let's say, and you see an orthopedic surgeon, and they may or may not recommend surgery, but they will recommend physical therapy, okay? And often the physical therapist and the surgeon will work together to help you get your knee better. So it's kind of like with a psychiatrist and a therapist or a psychologist. We work in tandem together, often as a team, to help from the top down and the bottom up, kind of, I like to say. So I hope you feel better, whatever you're struggling with, you and yours, and I hope this is helpful. If so, please subscribe to our channel. All right, you take care. Bye.